Let's talk about another treatment that you use. And a few years ago, probably maybe the same time I talked to you, we got a chance to talk to Charlotte Gerson. And one of the things she talked about, as well as many others, is coffee enemas. And I think when people first hear that, they think, whoa, 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 what? But talk about what you find in terms of success and how those are used.
Especially the big macho guy from, Texas or New Mexico that comes in with a cowboy hat. Hey, I'm not going there, I'm not going to do the coffee enema. But after about a week, he says, can I have two a day? So coffee enema. Coffee enema was in the Merck Manual, which is the Bible of medicine that medical students use, way before any laxatives were or any liver or gallbladder cleansing. But when pharmaceuticals came into existence, they pushed the coffee enemas out. So basically, coffee enemas are used to detoxify the liver and the gallbladder. It does a little bit of lower bowel cleansing, but not much. The main benefit is to work on the liver and the gallbladder. What type of coffee is used is very important. It needs to be a coffee that's caffeinated, organic, unroasted, and high amounts of something called palmitic acid, because that's what's going to start having the liver and the gallbladder contract and relax, so it could dump the toxins, right? So we get our coffee from S.A. Wilson's in Canada. They're in the eastern Canada in Ontario, and that's the coffee we use for the coffee enemas, which patients receive typically one a week. I know that in the Gerson protocol, they could do up to 5 coffee enemas a day, which is okay, but let's make it individualized for each patient. Some patients might need more than one a day, right, depending on how the liver function tests, how the toxicity is, but it's very safe. It gives you also like a burst of energy, and it's absorbed very quickly in the rectal area because we have blood vessels that go directly into the gallbladder and liver area. Do not keep or hold the coffee enema for longer than 15 minutes because then the toxin can reabsorb. So it's good to do it between 10 and 15 minutes, three days a week on a daily basis. If you're traveling, there's ways. We travel a lot, Scott. There's ways to, bring your own little kit and do it at the hotels, at least to help you with the jet lag, with your energy detoxify, because of course when we're traveling, we're not eating as healthy as we do when we're home.
So when you release toxins like that, I've heard of other detox methods where people just feel kind of crummy at first because of the toxins coming out. Do you get that same feeling with those treatments with the coffee enemas?
Not with the coffee enema, on the contrary. And this is what makes coffee enemas so critically important in a cancer protocol when we're dealing with multifactorial treatments, whether we're doing sonophotodynamic therapy, Rigvir, hyperthermia. Any treatment that's killing cancer cells needs to include coffee enemas because the patient's not going to get that crummy feeling. At Hope for Cancer, 86% of our patients are stage 4 that we're told to go home and there's nothing else to do. And we have 94% of our patients have significant improvement in quality of life, right? And I believe that the quality of life is greatly improved by treatments such as coffee enema because they're detoxing as you're working on the cancer. And that can be a problem because if someone has liver cancer, metastasis to the liver, or a lot of tumor load or tumor burden, we need to make sure that the pathways of elimination, which is the breathing, sweating, urination, and bowel movements are optimal so that they can detoxify and not feel crummy. And then we add onto all that the coffee enemas, and we have a very effective way to improve the quality of life of those patients as we're treating the cancer cells. So really, Scott, I don't believe of that old saying you have to feel worse before feeling better. I mean, who wants to feel worse? They've already been told, there's nothing we could do by their conventional doctors. So it's very important to have the patient feel better as they're doing the therapies because, of course, psychologically and spiritually, that's just going to inspire them, right, to do the therapies and continue them for an extended period of time, because as you said, or as I said, there's no magic bullet. In addition to that, it's a journey, and we need to learn from that journey.
Hi, and thanks for watching this video. If you like that video and you like our channel, the best thing you can do is support us with a Patreon donation. You can find the link here on the right. Also, subscribe to our YouTube channel. Again, that link here on the right. While you're at it, be sure to check out some of our more recent videos as well. You can find those right below. Thanks again for watching.